most dangerous part of a concussion is what's called second impact syndrome. So that's people sustaining a second concussion when they're still recovering from their first one. That's where the long-term neurological complications are the biggest issue. I mean, I'm talking paralysis or even death. That's a lot of the reason why we tend to play it very safe with concussions, because we're trying to minimize any long-term complications from it. Most concussions, people are going to gradually improve over time. I would say most people on average get better within a couple of weeks of the event. Now, you're always going to have patients that are going to be the outliers that last a little bit longer. And like I said, if it's not your first concussion, they tend to last a little bit longer. But for the most part, people get back to normal eventually. It's just a matter of time. What you worry about is getting back too quickly. There's a long range of symptoms. You know, simple headache, sensitivity to noise or light, nausea, vomiting, fatigue, poor concentration, depression, irritability, poor sleep, sleeping too much. I mean, pretty much anything can be a sign of a concussion. A lot of the old teaching around concussions revolved around you can't fall asleep with concussion, and you can't take medicine for the headaches. And now we know all that not to be true. So what I try to tell people is we're looking for any concerning neurological problems. So that's unequal pupils. That's someone who is not responsive when you try to arouse them. That's someone who's had numbness and tingling in their body along with a concussion. Other than that, it's just more of monitoring symptoms. So if they get nauseated, you can take nausea medicine. If you have a headache, you can take Tylenol, ibuprofen. I don't like to do ibuprofen in the first 24 hours, but after that, it's perfectly fine to take. Eventually, we want to get to the point where we're off all medicines and don't need them anymore, but really it's just more of symptomatic management at that point. The ER is usually going to get imaging to rule out anything neurological as a consequence of a potential traumatic brain injury. As far as athletes on the field go, the trainer is going to assess for any neurological complications. So loss of consciousness, numbness, tingling, unequal pupils, anything that just seems out of the ordinary for a tried and true, straightforward concussion. And so if those are the case, they're also going to get sent to the ER for evaluation. And so when I see them, if it's pretty straightforward, no neurological issues, a lot of times we just handle it here. If we have any concerns, then we'll get advanced imaging, and then depending on the results of those, they may end up seeing neurology for follow-up as well. Typically, patients, for the most part, if I'm seeing in the office, will already be diagnosed with a concussion. So for your high school athletes, a lot of times it's going to be diagnosed by the trainer at the game, on the field. They're going to rule out all the red flag symptoms to make sure everything is okay, and then just get them to follow up with me. I'll also see a lot of car accident patients, because people don't think about that causing concussions, but it actually is a very common reason. So a lot of times ER patients will get referred to me as well. Depending on insurance is how we dictate if you need a referral or not. So some insurances you can just make your own appointment. Some insurances, specifically like Medicaid for our kids and TRICARE, usually require a referral from your primary care doctor. So it just kind of depends on each individual's insurance.